I could keep on asking the panelists questions on and on, but I want to make sure that we have an opportunity for folks in the audience or folks who are calling in to ask questions or make comments. So I'm going to open it up, and I'm going to go with this gentleman here in the orange shirt to start. Go ahead, sir.
My name is Larry.
There's a mic coming your way.
Hi, Mike. I have a question. If I was a philanthropist, and I wish I was, I would come away from this discussion thinking, why should I give specifically to LGBT older adults? Because it sounded like there was nothing that differentiated LGBT adults from other adults. And considering that we have limited resources, breaking it down even further makes it more difficult to work on a budget. Another thing I thought is as we get older, the differences between heterosexuals and homosexuals decrease. Because I wonder if we were speaking about younger people, would the differences be more pronounced? And as we get older, there's less to distinguish us. So I'm wondering, I heard very little to give any sort of evidence that I, as a philanthropist, should give to LGBT adults, since nobody seemed to differentiate how we are different and how our needs are different. Thank you.
Well, I'm really glad that you said that, because if that's your takeaway, then I haven't done a good enough job here. So let me say a couple of thoughts in response to that. Certainly it is the case, and I think we all know in our life experiences, we are people. And we are LGBT people, those of us who are, right? And so our aging experiences share many things in common with other people's aging experiences. But certainly in our experience at SAGE, there are some very, very significant differences, and I touched on them at the beginning. Some of them have to do with the kind of support structures and family structures that tend to be available for most of us. What we know is, generally speaking, adult children and spouses and partners are the primary volunteer caregivers for older people in our society. And in many, many, many instances for LGBT folks, there are no adult children in the mix, and in many instances, there are no partners, right? So we have that kind of thinned out support network, which leads to a greater need for different kinds of supports that in other contexts family would provide. Although I think you're making a very good point that as time goes on, we're increasingly seeing that some of the experiences that LGBT elders have had for decades are becoming increasingly common for older people in general, right, as families become more dispersed. But I think it's also we really do need to note that it is the unfortunate reality that there is still not equitable treatment for LGBT older adults in the so-called safety net, for example, that LGBT older adults are not eligible for spousal and survivor benefits and death benefits and Social Security for their relationships, that in most parts of the country their assets are not protected if they're coupled in Medicaid and long-term care in the same way that they would be if they were a married heterosexual couple, that we still have many, many, many instances of, in some cases, garden variety discrimination in terms of the provision of services, and in perhaps many other cases simply a lack of understanding, a lack of knowledge that leads to culturally competent provision of care. So if the impression left for anybody here on the panel discussion and the breadth of it is that there are not particular challenges, I'm glad you raised that so we had the opportunity to say a little more about it. Sir.
Thank you. This is a very important question to me as a gay man who happens to be 74 years old. I would like to know whether Pfizer supports cuts in Social Security and Medicare benefits.
Okay, so I'm not in a I'm not in a position to. There are Pfizer people. Caroline, is there anything you'd be interested in saying about that? Or?
So, to be honest with you, I wasn't prepared for that question, and I'm probably not best positioned to answer it for you. But I'd be happy to follow up with you after the session, get your name, and we'll get back to you on it.
Yeah, I'm glad you asked the question, actually, because you know, as you may know, SAGE does a lot of policy work around those issues, and we do a lot of work with our corporate partners around those issues, and so that's something that we can follow up in conversation with Pfizer as well. So thank you for asking that. Yes, ma'am, in the teal blouse.
Thank you. I have the pleasure to work as a volunteer at SAGE 1 day a week, working with elder folks, LGBT folks, in public benefits. And one of the things I hear a lot, and I know from my own experience, having taken care of my dad, who was in an quote-unquote old age home for about 5 years, is the complete invisibility in these homes and the lack of respect for their population. I can't tell you the numbers of elderly people in old age homes that hide, are terrified to say it. They sit around as other people are talking. My husband's coming, my wife's coming. And I have seen personally people sit there who are obviously gay, and when I talked with them, they wouldn't say a word. They're afraid that they wouldn't be treated right. There is no respect, there's no encouragement, there's no acknowledgement, there's no honoring at all. And so all this is by way of asking, and of course I learned this from the people I counsel who have partners or friends in these homes in the city area. From what, you know, is SAGE or any organization doing anything like going in to so-called traditional old age homes, working with the people there to let them understand that there are many people that are there who do not fit the model of heterosexual lifestyles?
I'm going to say a couple of words, and then I'm going to see if Maya would like to add to that as well, because I know that in Portland they've been doing great work. Some of you know that SAGE sponsors a program called the National Resource Center on LGBT Aging, which is a public-private partnership that focuses precisely on what you're describing, focuses on providing training and technical assistance in skilled nursing facilities, in assisted living facilities, and in other kinds of aging provider settings to deal with these issues. I mean, one of the saddest things in our outreach so often is when we reach out to an aging provider, a facility of one sort or another, and we ask about providing a training, and what we hear back is, we don't have any LGBT people here. That's when we know there's a problem, right? And so that's what these training programs exist for. Maya, did you want to say a little bit about your experience in Portland and that work?
Yeah, we've been working on developing a housing assessment. In fact, we launched it last year as a pilot, working with a housing provider that we've been partnered with for years, and we did assessments in 5 of their communities, and it's really evaluating their policies, their practices around working with LGBT older adults. It's been interesting in that there are a ton of communities around who want us to go in to do it. Our capacity is really stretched right now. We've not been able to give this program the time and energy we want to. But some of the things that have come out of it, some of the ideas, and first let me say, all of our programming is led by our advisory teams that are all LGBT older adults or allies. And so this is all from them, and they have done an extraordinary job. But some of the really innovative ideas that have come out as a result are an ambassador program. So if there is an open out staff member or resident that's willing to wear some sort of a symbol that identifies them as being sensitive to the needs of that community, that's there somebody that they could go to be out, to come out to talk to about what's safe and not safe in this particular community. The other thing that we've been doing more recently is working close with our ombudsman program. So getting all of the local ombudsmans in our state trained to look for issues of discrimination or discrimination at its worst, abuse, but then also the more insidious types of things that we see happening a lot. You know, we hear stories of staff who have, of residents who've said, I want to go eat dinner, but none of the people at my table want me to sit there. And then the staff's recommendation is, well, we'll set up a dinner for you later so you don't have to sit with all of those people. So giving them ongoing support and in resolving some of those challenges differently. And also with the adult care homes is helping them better understand the needs. And again, this is an area where we would really like to grow, but our early work has been very interesting. The goal is to have an accreditation, some sort of an accreditation system. So at the end of the assessment, if they have met sort of the base outcomes, that they would have some sort of a sticker or opportunity to advertise on our websites. We're not quite there yet, but work is starting.
Great. I understand we have a caller with a question, and so we're going to see if we can get that question broadcast.
And our question will come from the line of Serena Worthington. Please proceed.
Thanks, everyone. Thanks, everybody. This has been really great. Can one of the panelists talk about how aging providers and LGBT organizations can work together to create LGBT-inclusive civic space for older adults?
Okay, so the question, as I understand it, is how LGBT organizations and aging service providers can work together to create good, supportive community spaces for LGBT older adults. And Maya, I think I might pass that back to you and see if you have thoughts on that.
Well, so again, back to our volunteers, we have 1.5 staff people, and so we are incredibly dependent on our volunteers. One of the strategies that we've employed is making sure that we have representation at all senior-related meetings, committees, and conversely, LGBT-related presence representing the needs of LGBT populations at senior meetings, and then conversely, making sure that older adults are represented on LGBT committees and whatnot. We have a volunteer who's sitting on the governor's board for aging services. But our connection with the AAA in our area, again, for us, that's Multnomah County, has been phenomenal, and they have been some of our biggest heroes over the last 12 years.
Great. Thank you, Maya. John?
I think one of the things to keep in mind is that we're very grateful to have SAGE. We're very grateful to have Open House in San Francisco and a handful of other organizations that have taken on this responsibility. LGBT organizations have not been great on aging issues, any better than aging groups have been good on LGBT issues. There's a lot of work to do in both communities. And once again, those of us who are part of both communities and may have either professional or personal connections to both communities really need to do a much better job about saying, look, where are you on these questions?
Well, and actually to that, I want to observe that the National Resource Center on LGBT Aging and its training work has 2 mandates. One is to train aging organizations to become more effective in working with LGBT older adults, but the other is to train LGBT organizations who often need to have as much to learn about older adults as aging organizations have to learn about LGBT adults. Unfortunately, as often happens in programs like this, our time is up. It's 5 p.m. I know there are many more questions, many more comments, which is the sign of a great program. Our panelists will be able to be here after for a few minutes for questions and comments you might have. There is also a reception so we can continue this conversation, a reception in the next room. But I want to thank the panelists so much for your contributions and for your very interesting observations. Thank Maya for coming in and speaking with us in Portland. Thank each of you for your attention, the passion, and we look forward to the next in this series. Thank you.